I'm a pediatric emergency physician, currently professor and chair and senior associate dean for clinical affairs at the Florida Atlantic University College of Medicine in Palm Beach County, Florida. Up until February, I was a senior executive in the military health system at the Department of Defense, one of the largest healthcare systems in the United States, and previously was a federal senior medical official during the 2009 H1N1 pandemic. And up until this year, I worked clinically in emergency medicine on the front lines, like many of you. I want to thank Leapfrog Group for giving me the opportunity to talk about a really critical topic, especially at this point of the pandemic, community mitigation strategies. And there is a role for all of us, not just the healthcare community, but for everybody in helping to promote and have our officials and leadership enforce community mitigation strategies. The reason why these strategies are so critical to the healthcare system is that they're meant to keep the number of patients below the capabilities of our healthcare system. So we need to reduce that peak of those affected with COVID-19. So what is it that we want to promote? First is social distancing. And there are a number of strategies with regard to social distancing, and that's occurring in a lot of places right now. Schools have been closed in most communities. And the reason for that is because children are thought to be like super spreaders. It's not clear with the coronavirus that that's the case like it is in influenza, but there's also adults that work at schools and others who may be at risk in the school setting. And so it's very important that schools close, that universities are closed as well, and that all go to remote education strategies. This is really critical, and we can't keep our foot off the gas. We need to do this for at least 8 weeks in order to keep that curve down. Other strategies include not only remote work, but closure of public places. Because once people are now working from home or schools are closed, people may tend to congregate in public places. So you need to really encourage your state and local leadership to close beaches, parks, and any other place that people congregate. Already, a lot of places around the country where people do go for entertainment have been closed. And so that's a good thing. Also, importantly, we need to promote wider testing. There's so much variability across the country with regard to people being tested. And this really creates a blind spot for us, for public health and for our healthcare community and the public. For example, this morning there was a tweet by our Lieutenant Governor in the state of Florida that asserted that there were a good number of counties, that 20 counties that didn't have any cases. However, in our state of Florida, testing has been very restricted, and there's a number of healthcare institutions that don't have that capability within their hospitals. And so we really don't have a good picture for where people are being affected and where we are on the curve. And lastly, whether or not our community mitigation strategies are working. And so testing is really important. One thing that we're doing at Florida Atlantic University is we're investigating whether or not we could set up a testing site utilizing our research lab capabilities. The FDA relaxed their requirements for testing by allowing states to make that determination about whether testing devices can be used. So we're looking into that. And I know that there's at least a couple other places across the country that are doing this, and this will help reduce the burden on our public health agencies and our hospitals with regard to testing if, for example, we were to prioritize testing of healthcare providers at sites like that. So there's a lot that we should be doing in ensuring that our community adheres to our community mitigation strategies. Thank you.